Hello, everyone. My name is Dafina Felix, and this is case study number 2. Okay, so we are going to kick it off with the maladaptive behaviors. So, I don't want to read all of the maladaptive behaviors, but he has a total of 7 in his repertoire right now. And this is just to highlight the task list H1, which is to state the goals in observable and measurable terms. So, the one that we're going to be talking about is aggression, which is any instance or an attempt in which he engages in physical contact with another person through hitting, kicking, pushing, etc. So, an example of this would be kicking a peer when they took an item from him, and a non example would be giving a high five to someone. I'm just going to scroll through so you can see the other ones. Here are some more of the maladaptive behaviors that are in his repertoire for you to look at. To continue task list H1, the intervention that we wrote up was anytime he engages in aggression for attention or tangibles, prompt the appropriate way with modeling a tap and or vocally stating name and prompting the item he is requesting. So in this slide, we are going to be discussing the interventions that could be used for aggression to highlight the task list H2, which is identifying potential interventions based on assessment results and best available scientific evidence, and H3, which is recommending intervention goals and strategies based on such factors as clients' preferences, supporting environments, risk, constraints, and social validity. So, there are many treatments that have been studied that prove to be evidence based to help treat aggressions in individuals diagnosed with ASD. So, we have reinforcement strategies such as FCT, which is functional communication training, DRO, which is differential reinforcement of other behavior, DRI, differential reinforcement of incompatible behavior, DRA, differential reinforcement of alternative behavior, DRL, which is differential reinforcement of low rates of behavior, and non-contingent reinforcement, which is these are all reinforcement strategies that can help gain access to the reinforcer in an appropriate manner while still hitting the check boxes of being socially acceptable, readily available with minimum risk and constraints. So there are also treatments such as pharmaceutical treatments and generation antipsychotics. Whenever choosing a treatment procedure for the client, we always want to make sure that we are going with a less intrusive treatment. Given that he is a 4-year-old kid that never had ABA, never had access to reinforcement, which is always the first thing that we should try when we're treating. He never had got the opportunity to see if it worked or not. So this is his goal to see if we should move to more intrusive treatments such as pharmaceutical and second generation antipsychotics, which as he's progressing, I don't really feel like it is necessary for him. But only time can tell, so we can look at the data and see, what is appropriate to move forward. It has to be scientific and not based on biases. But the function of the client's aggression after running the informal FBA was to obtain access to tangibles and attention. So we're going to move right on and see which one we chose. Okay, on this slide, we are going to be highlighting H4, which is when a target behavior is to be decreased, select an acceptable alternative behavior to be established or increased. H5 is planning for possible unwanted effects when using reinforcement, extinction, and punishment procedures. So, the function of the client aggression is what is most important to understanding what procedure that we should use. So he was engaging in aggression to gain access to intangibles and attention. So with that being said, we thought that FCT would be the most appropriate replacement behavior for him. And FCT is functional communication training, which is an differential reinforcement procedure in which an individual is taught alternative responses that has the same class of reinforcement as the maladaptive behavior. So, yeah, we want him to learn that there's other ways to get what you need, and utilizing your form of your words is a better form, it's better socially acceptable, and is better altogether of gaining what you need. So some unwanted effects that we did plan for is making sure that we are expanding his vocabulary. So, for example, we're not just saying toy once we know that he wants a specific item. Instead, we are elaborating, being more specific on what the item actually is. So, we're not creating a toy. That can also later on result in more maladaptive behaviors because I'm requesting it and I'm using my words, and now you're not understanding me, which could be another frustration that the child has to endure. And we just want to make sure that we're being as specific as possible to reduce the likelihood of that occurring. So another unwanted effect is making sure that we're not chaining that aggression and asking. We don't want him to come up and hit us and then ask for the toy and we give the toy. So now we paired him hitting and receiving the item that he wants, and now he thinks it's okay and acceptable. So we want to make sure that we're only providing access to that reinforcer with when it is appropriate. So on this next slide, we are going to be highlighting H6, which is monitoring the client's progress and treatment integrities, and H2, responsibilities as a professional. So we want to make sure that the parents are involved as much as possible, because the parents or caretakers are involved, because this is the child that they so love, and a lot of the stuff that we are learning at school always has to be maintained in the household. That helps with generalization as well. You know, he has to be able to generalize this behavior in the multiple settings across multiple people. So, yeah, we want to make sure the parents are involved. And prior to providing any treatment, we have to make sure we get parental consent, and even if we're making changes. And scent comes to play every single day. So every time we're implementing procedure, we want to make sure that the client is on board and utilize stuff that he's motivated for, just that we're acting in the best interest of him. And he's very adamant about telling you when you are pushing him beyond his limits. With that being said, we also want to make sure that we are keeping a balance of teaching meaningful skills while respecting these boundaries. At my company, we do have 2 meetings per month where we discuss progress and treatment integrities. This is just where we basically see if what we have in place is actively working for the child at home and in the center. So yeah, being culturally sensitive is extremely important, and that brings us to highlight E7, which is our responsibility in research. We want to make sure that we're doing as much research as possible, especially when we're working in backgrounds that we're not familiar with. And even so, your research is not enough. Instead of pulling straight from what you've researched, you always have to make sure that research is indeed connected with what the parents or the clients are actively teaching. So making sure you ask questions instead of inferring is extremely valuable and extremely important, because you don't want to assume anything. That could also become really offensive. So yeah, make sure I'm asking questions and just being respectful, and making sure that I'm aware of my biases is really important. So here are some references that I had utilized in completion of this case study. I pulled Fitzpatrick and his colleagues helped me get a better understanding of the treatments that are utilized for aggression, and Tiger and his colleagues helped me with some functional communication training. I really appreciate you for making it to the end. I know that was a mouthful. Thank you a lot. And I am still looking forward to completing these case studies. I'm having so much fun.